That's what we deal with every day. We got it.
Yeah, so when we started this project, the original funding was from National Institute on Drug Abuse, and the aim was to test an intervention to reduce HIV transmission and infections among people who are injecting drugs at the time. We had an intervention that was developed that was using folks who were former injectors to be able to go out and reach people that were at risk. The immediate impact was that within 6 months we saw a dramatic drop in HIV transmission.
I first got the job, I had just gotten clean off of using drugs myself, and I was told by someone that I knew that this University of Illinois School of Public Health was looking for outreach workers to inform injection drug users about HIV. It allowed me to raise my daughter. It hasn't been easy. It hasn't been easy. It allowed me to raise my daughter. It allowed me to gain dignity back. It has allowed me to travel back to my country where I originally came from, you know, by having a job for it's my life. It saved my life.
I could just sell us as a community-based organization in a way, but we have a lot of active research and scholarly activity that's driving both what we do, the questions that we ask, the services we provide, and then the new services that we reach out for based on what we are learning about where the epidemic is going, who's being affected, who are the new populations that we need to reach, that sort of thing.
I went with some friends to Vermont, Burlington, Vermont, and we went snowboarding up there. And I tried to do this trick and I broke my leg really bad. I got prescribed Percocet and Norcos. And you know, the instant I took them, literally the first time I took them, I'd never taken opiates before. I never drank either my first semester at college, and I took them, and this switch just went on in my head, and it was like, this is the best feeling you ever had, you know.
On top of being physically ill, you also have depression. You have deep depression. On top of that, you're struggling with guilt and shame and worry and post-traumatic stress. Those are the people that work in here. For all the communities that has these field stations, I think it is a place of safety, a place where you can come. It doesn't matter who you are, what you're wearing, what your problem is. Somebody is going to reach out to you.
Here, they just get you. They know. So this place needs to stay here. I mean, that's really how I feel.
COIP has really been a life-changing experience. So hard, but yet I'm like so focused now than I've ever been.
Don't mess with COIP, leave COIP right here. This is the clinic for our neighborhood.
The people that we service here, a lot of times the only thing you can give them is hope, a little bit of hope. Let me help you, let me take you, let me just point the way for you. You don't have to take it now, today, but just take my hand and I'll show you how to get there.